If you're dealing with lower back pain whenever you stand prolonged, walk for a while, arch backwards, or just exist for more than 10 minutes, or you've been told you've got a little bit of banana back or duck butt posture, this video is for you. What you're usually experiencing here is called extension-related low back pain or extension intolerance, and it's often caused by a pattern that I call lumbopelvic dysfunction. Now, for many people, this posture, this pattern is totally fine, and it doesn't bother them at all. But for a whole bunch of people, certain components of their anatomy get stiff and tight and tense and weak, resulting in this pattern. And it can be causing a lot of the movement dysfunction that is creating some of your aches and pains and consistent soreness. So within this pattern, your lower back arches excessively, your pelvis rolls forward, your glutes stick out behind you, your belly kind of pops out. Looks great for social media selfies, not so great for your spine over time. Again, the posture, the pattern, isn't really the problem. It's the movement dysfunction that happens within that pattern. Your hip flexors become tense and weak, yanking your pelvis forward. Your core muscles kind of go on vacation, and your griddle cake glutes are meeting them there. Your poor lower back is left handling business while everybody else is out of the office. This leads to a lot of compression and irritation to those lower lumbar spinal joints. And now, ta-da, you've got consistent tension, tightness, and even an intermittent, pinchy, sharp pain down in that lower back. After emailing about 1 million patients pieces of this sequence, I finally decided to just jam it all together into one video and one little mobility flow that can be done regularly. I'd suggest maybe 3 to 4 times a week, but you could do it every day. To help a lot of my Gen Pop or my general population patients manage this situation and do it in about 10 minutes or so. All right, let's go. Okay, first exercise we got here, heel push knee chest stretch. So you probably want something to support your head here, just to allow yourself to kind of relax into this. But the key here is that you really want to focus on pushing this heel really hard into the ground as you do this. So we're going to make this kind of a stretching and strengthening exercise here. So we're going to do a couple sets, 5 reps, 2-second hold at the top. So you can see I'm actively using my hip flexor to pull my leg up. And then once I get it there, I'm going to pull it a little extra with a little passive range of motion assistance here. But the key here is that opposite leg, that down leg, is pushing hard into the ground. So I sped the video up a little bit here just so we don't waste all day talking about this. But a couple sets, 5 reps, 2-second hold or so should get it done there. Next one we're going to go right into, conveniently already in this position, we're going to go right into a curl up, the McGill curl up. So all you're going to do is put your hands underneath, and then you're going to stagger the legs like that, and then you're just going to lift your head and chest up off of whatever you're resting it on. Could be the ground, could be a foam roller, could be a pillow, something like that. All right, you're going to see this is a pretty intense core exercise. You're trying to push your belly button towards your hands and just lift just that much off. Just switch the legs for the second set here, but you're going to see as I lift, I'm trembling a little bit. You're going to see my hat and my chin kind of shaking a little bit there. This is a lot more difficult than it might look, okay? Especially if you're engaging all the right stuff. Great core exercise, low barrier of entry here. You don't have to have your head resting on something here. You can just kind of move whatever's there too, and you can go right from the ground, but you still only want to lift about that high. Elbows can come off the floor a little bit. Matter of fact, they're supposed to, but doesn't really have to be something to focus on within this exercise. You'll feel what you need to feel just by lifting your head and chest. All right, now from the same position, we're going to conveniently go right into a glute bridge. These are pretty self-explanatory. Just want to set up just like that. You're going to push your hips straight up towards the ceiling, squeezing the glutes, pinching a penny hard at the top, okay? Couple sets of 10 reps, 2-second hold at the top. You can play around with your foot position a little bit if you need to. If you feel your hamstrings cramping, you might want to modify that a little bit. I like to put my elbows hard into the ground like that so I stabilize everything up top and I can really focus on squeezing my glutes straight through. Think about pushing your hips through and towards the ceiling there. But here you can see I'm going to play around with the foot position. Sometimes people like them a little higher. Sometimes people like them a little further out. It's going to be a personal preference thing. Just whatever you need to do to feel your glutes really engage and fire up and even create a little burn in them. All right, an easy progression to this would be to throw on a glute loop or a little mini booty band here like this, and then get these abductors a little bit more involved, pushing out against the band as you perform the same exact exercise. Just gonna add a little bit more of those abductors to the equation. Helps practice kind of like the squat stance when you should be pushing your knee out as you descend into the squat. All right, next exercise here. So we're gonna go right into some iso chin tucks. So again, we're in the same exact position. This is a nice little routine that you'll be able to do if you just really wanna hit all the things that I find most of my patients need. So here we're just trying to do a nice little double chin type maneuver here. We're pulling our chin straight back, like we're trying to make a big double chin, and we're pushing into whatever we're resting our head on. Could be a pillow, could be a yoga mat like I've got there, could be anything, but obviously your head wants to be kind of in a neutral position to start, and then you're just gonna kind of protrude it forward a little bit and then pull firmly straight back, making a big double chin, pressing into whatever you're pressing it into and holding for a couple seconds. You're gonna feel a deep fatigue deep in the neck here. You shouldn't feel a ton of superficial tension. This is gonna feel like a deep fatigue, almost like in the throat almost. That's engaging the deep neck flexor muscles. If you feel it there, you know you're doing it right. Next, we're going right into what we call book openers, or like a lying thoracic rotation. These are one of my favorites to have patients do, but really this helps to kind of synchronize this with your breathing and bring that arm up and over like you're trying to create this big half circle. But you don't necessarily have to do that. You can go straight over if you need to, but really you want to synchronize this with your breathing. So you want an exhale there, and then after you complete the exhale, you bring it on back. So maybe an inhale here, and then exhale as you're going all the way over. Now you can come straight over if you don't have the shoulder mobility to do the big arching kind of half circle maneuver. You can just go straight over, but still exhale here, inhale as you come back. All right, let's do the other side. This will be a little easier to see over here. You want something between your legs so you keep your hips from rolling too much with you. So again, nice big exhale, and then come on back. Nice big inhale here. Oh, fix your hat if you need to. Inhale, exhale as you're going all the way across. Notice how my knees are staying kind of pointing this way as my upper body turns and stretches out that way. Again, don't hold it. Just complete the rep with the exhale and then come on back. Again, you can go straight over if your shoulders are kind of crabby and not really liking the up and over, but eventually you would progress to this big circle, half circle kind of maneuver that you'll see here. Again, that's the easier way. This would be a little bit more difficult, but you get a little bit more out of it. Nice little exhale, and then come on back. Perfect. All right, next one, floor angels. So the key with this is that we're gonna try to keep our low back flat to the ground, okay? We don't want our ribs to pop up too much, but we're just gonna take our arms overhead, kind of a nice little stretch. When we go overhead, keeping the low back flat to the ground. And then when we come down, I want you to treat this almost like a behind the neck lat pull down. You're gonna squeeze those shoulder blades down, okay? But again, don't let your ribs pop up. Keep your low back flat to the ground, just like that, okay? That's number one. And then as we do that, we can go up, we get a big stretch, shoulders and everything, and then we squeeze like we're doing like a lat pull down at the bottom, not letting that rib cage pop up too much. All right, then we're just gonna flip right over and we're gonna go into just some crocodile breaths. So just 10 big deep breaths, keeping the hips on the ground, but propped up on your elbows like that. Now notice the position of my elbows. See how my elbow is directly under my shoulder? People get in trouble if they have that elbow too far back or too far forward because it can be uncomfortable. But in that position, you can really relax with that elbow directly underneath the shoulder. Just big expansive breaths, trying to breathe into the ground, trying to let your diaphragm and your entire core just kind of expand every time you inhale. And then as you exhale, you just let it fall back down. Now we're gonna pop back into a child's pose and do the same thing. So from this position, big expansive breaths, nice relaxing exhale from this position. Sit as far back as you can. My knees were a little crabby this day, so I couldn't really sit back onto my heels, but if you have that mobility, go ahead and do that. Then we're gonna go right into some prone press-ups, all right? Sometimes these are called crappy push-ups, crummy push-ups. All right, again, you're trying to keep your hip or your pocket area somewhat on the ground. It might come up a little bit, but you really wanna be careful with your hand position here. I think it's easiest to do it way out there. People get in trouble when they bring their hands way too far back, just like I was kind of explaining, because it gets hard on the shoulder. But from that position, it's pretty easy. From here, it's pretty difficult. One, you're taking more range of motion into the equation here, and it's kind of harder on the shoulder, But way out here, much easier, okay? And that's about all you need for this exercise. You're just trying to loosen those joints up and create a little bit of an extension force to counter a lot of the flexion forces that people are constantly in. All right, now to progress this a little bit, this could be a progression, or you could just make this part of the routine. But we're gonna do what I would call a press up rock back. So you're gonna go big expansive inhale back into that child's pose, and then you're gonna drop down into a long relaxing exhale into the press up. So big expansive inhale, and then drop down, long relaxing exhale. So we're combining both those last two exercises into one nice little mobility flow here. And it actually feels really good once you've gotten everything loosened up a little bit to kind of end with this. And I love just encouraging these big expansive breaths. I feel like people don't breathe enough throughout the day. Everybody's kind of caught in this fight or flight mode, and we need to just breathe. So half of all these exercises, we just want to make sure we're breathing nice and deep and relaxing.